Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Dear fellows, my students, my colleagues, and those who are appearing in the in-country examinations or outside this country examinations, foreign examinations. Actually, we are dealing with infection and infection leading to the disease, infection and disease. This was a topic which is a very important topic. I say that it is 30 to 35% covering the whole of the internal medicine is concerned. And in the Harrison textbook of medicine, it comprises about 300 or 400 pages. And you can imagine how much is written for this infective process or infection is concerned. I am Professor S.A.D. Yadav. I am a visiting professor of internal medicine, JSMU, and I am also taking the regular classes on the basis that people should take interest in the internal medicine's basics of the internal medicine. So, the basics of the internal medicine should be known to everybody, otherwise you cannot properly evaluate the patient. So today we are dealing actually with some of the gram-negative cocci. There are two gram-negative cocci, which is one is the Neisseria meningitidis, and second one is the Neisseria gonorrhoeae. And if somebody will ask you in the examination or elsewhere, this disease, which is written as meningococcal disease, what is this? Or what are the causes of the meningitis? Or what will you do if you remove the spleen? Because it is one of the most invasive organisms, the meningococcal disease. And remember, this disease, which I have seen in my life, is about 30 to 40 cases of the meningococcal disease. It means one disease per year. Till now, actually, the other causes of the meningitis are more than the Neisseria meningitidis because of the better hygiene, you can say, or the better awareness. The disease is not very common, but one should know all of the basics and pathogenic process and the clinical features, the diagnostic criteria, and then the management strategies regarding this disease. The introduction of this disease, the meningococcal disease, describes the infection caused by the bacterium, which is known as the Neisseria meningitidis. And this is the family which is given here. Neisseria meningitidis, also termed the meningococcus. It has high mortality rate if untreated. The natural history of this disease means that if it is not treated, then the patient will definitely, there will be 90% mortality rate or morbidity will be increased. But it is vaccine preventable. Vaccine is developed to prevent this disease where there are endemics or epidemics of this disease. While best known as the cause of the meningitis, it can also result in sepsis, which is an even more damaging and dangerous conditions. Meningitis and meningococcemia are the major causes of illness and death and disability in the both developed and underdeveloped countries. Now this subject is very well written in the textbook of the pathology. Robin's text book of the pathology, it is beautifully written there. If anybody want to see the more knowledge, to gain more knowledge from this, he should read first of all, the textbook of pathology by Robbins, and then come to you can follow the Davidson textbook of medicine or PK. If you want to know more of it, you go to the Harrison textbook of internal medicine or go for the current medical diagnosis. In my opinion, there is no fashion of making notes now. People are totally dependent on the search engines, and they study from this. Now comparing the two people, one who is book bound and making notes, and another one who is dependent on the search engine in the internet, Google or some engine, search engine. So this cannot be actually, you cannot compare with the two people, because one who have seen the patient, who have studied from the books, and who have actually making notes of the disease, he can remember it many years. Recalling power is much increased for these people. But those who are dependent on the internet, their memory will be declining soon. And then they don't know even after this that the meningococcus, which type of the organism it is. If you say it is gram-positive coccus, this is possibly it is. If you say that from the 5 cocci, which is the most novel, or you can say invasive coccus ever produced in the world, what's the answer? They will answer that Streptococcus viridans, because it is more common, and it is more seen by you as the septicemia or what elsewhere, other diseases as well. But this is the most invasive organism, the meningococcus. There are 3 types of problem with it. One, it is the cocci, the meningococcus has affinity towards the meninges. Number 1, so it will cause meningitis. Or you can say secondary serous membranes. Number secondly, it can cause the whole of it. That is, it will cause first of all the transient bacteremia, and then bacteremia. If they multiply more, then it will cause septicemia. It can cause the systemic inflammatory response syndrome, and it causes septicemia. It will cause the sepsis, septic shock, or it will cause the MODS, and so on afterwards. That is the erythrophagosecretory syndrome. In the end, the patient will die because of the DIC, because of the ARDS. This is the fate in this condition, acute meningococcemia. Now, chronic meningococcemia is another disease which develops after the attack of the disease. It is said that the chronic meningococcemia occurs because of reinfection, number 1, or it may occur because it has produced the immunity towards the antigens of the meningococcus, so the disease will recur after 4 weeks or 8 weeks or more than that. But this type of the meningococcemia, that is chronic meningococcemia, will cause the target organ damage. Like the other diseases, target organ damage, for example, in coronavirus, the target organ damage are well described. Because it will not affect the bone. For example, the coronavirus is concerned. When you say the Staphylococcus aureus, yes, it will infect the bone. It is a target for the Staphylococcus aureus or Staphylococcus epidermidis. But here, there are 3 types of problems. Number 1 is the meningitis, meningitis, or acute meningococcemia and chronic meningococcemia. The pathogenesis is that the disease pathogenesis is not fully understood. Neisseria meningitis colonizes a substantial proportion of the general population harmlessly as commensals, but in a very small percentage of individuals it can invade the body stream, affecting the entire body, most notably the limbs and the brain, causing the serious illness. It is simplified in conditions, for example, those people who are picking the garbage from the households or from other places, they are coming from the Afghanistan, they are refugees. They are picking something important in the garbage you have thrown out. Now, in my study, which I have seen these cases of thousands of the Afghan refugees, nobody developed any type of the problem like this. No meningitis, no coronavirus, no coronavirus. No coronavirus has been detected in them. Otherwise, you have taken the what is called the life-saving passive immunity from them. They donate the blood, and you will extract the serum from it, and then give the patient. Actually, he is a senior person. He was salvaged by giving 3 or 4 samples given by the Afghan refugees, and he saved. And he came out in the age of 80 years, 82 years from the coronavirus, although he developed the ARDS. It's a miracle, because these people, they are hovering around and around there and there, and they have developed the acquired immunity, and that's why they are resistant. But those people who are living inside for example, the posh areas, they have these bacteria are present entirely on the different parts of your body and around it. If they invade it, your immunity is not able to combat this infection. This is the problem. Because nowadays, because the vaccination program has been going on, and the tertiary care hospital who are actually charging more and more from these people, they vaccinate these people. It is a costly vaccine, and it comes under the heading of triple vaccination, that is hemophilus with Neisseria meningitis, and thirdly from this organism, the third organism, that is the Streptococcus pneumoniae, or the specific vaccine is also available. So they can be saved, no doubt, but this is a very, very difficult to manage. It is not easy to manage. Over the past few years, experts have made an intensive effort to understand the specific aspects of the meningococcal biology and the host interactions, However, the development of the improved treatments and effective vaccinations expected to depend on the novel efforts by the workers in many different fields. While meningococcal disease is not a contagious as a common cold, it is spread through the casual contact. It can be transmitted through saliva and occasionally through close, prolonged general contact with the infected person. So it is infectious disease. Previously, somebody called me to say that, can you describe that enteric fever is a infectious process, or infectious disease it is? Yes, of course, it is infectious disease. Because there are 2 types of problems with the salmonella is concerned. It may be auto-infection, it may go through your saliva, and it can spread by feces. The fecal-oral route is the main problem. Hand washings, properly have not been done, and the contamination is there in most of the part of your country. In the same way, these meningococci, they are spread is through the portal of entry is the upper respiratory tract, the nose and the posterior pharynx. The most common is site of the portal of entry. The complications following the meningococcal disease can be divided into early and the late growths. Now the early complication, this is meningococemia, which he is describing actually, is that raised intracranial pressure because it will cause the swelling of the meninges and disseminated intravascular coagulation. That is a problem with every disease, which is going into septicemia and going to pyemia and then going into the sepsis and septic shock. Seizures, because it is very near to the cerebrum, and circulatory collapse and organ failure. There is multi-organ dysfunction syndrome in the end. The little complication afterwards, remnant, it can cause deafness by destroying the vestibular organ nerve, blindness because it will cause the destruction of the retina, lasting neurological deficit. It can reduce the intellectual quotient, IQ, and it can cause the gangrene because of the vasculitis, because of the thrombosis of the peripheral parts leading to the amputations. Have you ever heard about it? Honestly speaking, these are the complications of the meningococcal disease. Other than meningitis, yes, there are certain diseases which should be discussed. I see the meningitis all right. Acute meningococemia, yes. Chronic meningococemia because it can lead to the remnant infection in your body or remnant or disabilities in your body. So there are three things which are important associated with this disease. One is Waterhouse-Friderichsen syndrome. This is very, very interesting disease. When you will learn the Addison's disease, the commonest cause of the Addison's disease is one is tuberculosis in this world, or autoimmune disease is a part of the adrenalitis because of the many, many diseases causing the adrenalitis. Or it can cause the what is called vasculitis, causing the damage to the adrenal glands. It may be one is disease which is very not known as by you many times as fungal infections. They can directly invade the adrenal glands. Secondaries may be found in the adrenals also. But one is in the chronic meningococemia, what is called the Waterhouse-Friderichsen syndrome is a group of the symptoms caused when the adrenal glands fail to function normally. It could cause the acute adrenocortical insufficiency if it is associated with the acute meningococemia, or it will cause the frank, which is called frank type of the Addison disease in cases of the chronic meningococemia. So it will cause the acute, or it will be called the chronic deficiency of the adrenal hormones, specifically speaking the mineralocorticoids and glucocorticoids. If somebody is discussing the acute adrenocortical insufficiency, of course, a time will come when you will come across this type of problem in examination or elsewhere. Remember that this disease is very important. The Waterhouse-Friderichsen syndrome is a remote complication actually of the meningococemia. And it should be managed very, very quickly, otherwise the patient will die because of severe adrenocortical insufficiency, hypertension, shock, circulatory collapse. The types I have already mentioned out. it is a meningococcemia. Like many other gram-negative blood infection can cause disseminated intravascular coagulation, which is the inappropriate clotting of the blood within the vessels. And DIC can cause ischemic tissue damage, and the upstream thrombi obstruct the blood flow and the hemorrhage because the clotting factors are exhausted. Deficiency occurs of the natural anticoagulants here. A small bleeds into the skin cause the characteristic what is called as the petechial rash, very specifically speaking in acute meningococcemia, which appears with a star-like shape, very specific rash. It's a dark color, reddish, star-like shape. This is due to the release of toxins into the blood. There are toxins associated with the meningococci, which is causing the vasculitis and the vessels. The black and the blue blood ooze out from this vessel. A rash will develop under the skin due to the blood leakage that may leave red or brownish pin prick spots. That is the petechial type of a rash, which can develop into purple bruising. And the meningococcal rash can usually be confirmed by the glass test, in which the rash does not fade away under pressure. Venous star of the 80s, that is called. If you have to describe in the spider nevi again, in which the rash does not fade. If you put a pen or a pencil and block the center of the spider nevi, it will fade out. Or if you pressurize highly pressurize whole of the lesion, then the venous star will fade out. But this rash will not fade out under the pressure. This is the characteristic of the rash of the meningococcemia. As far as meningitis is concerned, the meningitis caused by the meningococci is a form of the bacterial meningitis. Meningitis is a disease caused by the inflammation and irritation of the meninges. Only irritation is there, meningism. If it is inflamed, it is called meningitis. The membrane surrounding the brain and the spinal cord in the meningococcal meningitis, this is caused by the bacteria invading the CSF and circulating through the central nervous system. And African and Americans in the Western Europe and UK and Ireland still face many challenges combating this disease. Although these countries, which I have said, these are temperate zones, this disease is still prevailing there. But in our region, it is not very common. It may be missed by you because you have not seen it previously. As with any gram-negative bacterium, the disease of meningitis can infect a variety of sites. So localized infection with the meningococcus can occur. And meningococcal pneumonia, it is definitely a complication, can appear during the influenza pandemics and in military camps. So it's a comorbid. This is a multi-lobar, rapidly involving pneumonia, sometimes associated with the septic shock. With prompt treatment, the prognosis is excellent. Another alternative is the dexamethasone, given with vancomycin and meropenem. Now, in this disease, pericarditis can appear as focal, either as a septic pericarditis, which a great prognosis, or as a reactive pericarditis in the wake of the meningitis or septicemia. It may be a reactive type of pericarditis, just like reactive arthritis. So it is autoimmune phenomenon for the toxins released by the meningococci. These are symptoms which are given actually here. The central is the headache and the altered mental status, sensorium disturbances. Ears, it can cause the phonophobia. And in the eyes, bright lights, they are unbearable because in the high increased intracranial pressure. Systemic, there will be high fever and it can cause irritation to the pre-central gyrus, the post-central gyrus, or around the, in the middle, the temporal lobe is concerned. It will cause the seizures and still neck rigidity of the neck, and it will cause the insomnia or difficulty in waking. It can cause increased drowsiness. It can cause sleeplessness. Both can occur depending upon the severity of the condition. Because it's systemic infection, it can cause nausea and vomiting. In the skin, I said already that is petechiae occur, and the hemorrhagic rashes occur, pain, spots, rash, blotchy rashes. It should come under the diagnosis of hemorrhagic fevers, remember. And the muscles are unself-involved, the fatigue because of the inflammation. That is, the severe muscle spasm can occur. It can cause the myopathy and then the weakness and other things. There is possibility with diseases. Clinically, you find there is what is called as neck rigidity and the demonstration of the Carnick sign and the Brudisky sign. How we do in our clinics, we will demonstrate at one time when I will see the patient and being asked to examine the central nervous system, then I will demonstrate to you how to do this neck rigidity, how to do the Carnick's and Brudisky sign. Now coming to the another part in the discussion is bacteriology. People don't like this type of discussion actually. But you have to remember, you have to gain knowledge to pass the fellowship examination at least. Or you are going for the PhD examination, everything will be asked. The Neisseria meningitis bacterium is surrounded by a slimy outer coat that contains disease-causing endotoxin. It will cause endotoxemia then. When many bacteria produce endotoxin, the levels produced by the meningococcal bacteria are 100 to 1000 times greater. Look, the load giving by it. Then normal, as the bacteria multiply and move through the bloodstream, it sheds concentrated amount of the toxins. So endotoxemia occur. The endotoxin directly affects the heart, reducing its ability to circulate blood. So there will be a circulatory collapse will be there, cardiovascular collapse will be there, and also causes pressure on the vessels, blood vessels throughout the body because it causes vasculitis. As some blood vessels start to hemorrhage, major organs like the lungs and the kidneys are damaged. In the same fashion, the Waterhouse-Friderichsen syndrome occurs. And this is the bacteria. If it is gram-positive, it should be purple color, violet color, purple color. If it is pink under the gram stain, it will appear as pink or reddish tinge. Just like this you see. There are small, organisms are there here in this case. They are occurring in the groups here. In the blood, this is blood sample. The gram-negative organisms cocci are seen in this case, along with the other blood elements which are seen also. Investigation due to the blood CBC will cause the total leukocyte count will be increased. Neutrophil leukocytosis. Acute phase reactant, all are increased. CRP is the main marker. ESR, CRP increased. Throat and blood culture. Throat examination can reveal it if done properly. And blood culture, when you see there is a systemic illness, whether acute meningococcemia or the chronic meningococcemia, if you have not given the antibiotics previously, then the blood culture positivity is 90 to 95% positive. They are also doing the PCR examination nowadays for the saliva or the nasal swab for the meningococcus. Now, CSF analysis is high WBC counts, number 1, number 2, predominant neutrophil, number 3, protein will be high and sugar will be low. 4 things are should be there for justification of the involvement of the meninges. CSF analysis should be done, spinal tap should be done. The microscopic examination can reveal the gram-negative meningococci direct evidence. Whether you are going for the CSF analysis or throat swab or the bronchoalveolar lavage, whatever it is, the microscopy is direct evidence revealing the gram-negative meningococcus. You can culture it. For the classical Neisseria meningitidis, the culture will be provided. Specific culture media are used by the clinical microbiologists. The management. When a meningococcal disease is suspected, the treatment must be started immediately because it is a very high mortality and should be delayed, not be delayed waiting for investigation. You start now, blood will be withdrawn for investigation, and CSF tap should be done as soon as possible, and then start treatment. In the primary care, where their facilities are less, the triple regime is sufficient. That is benzyl penicillin, it is very sensitive against the meningococci, plus you will give the gentamicin, plus you will give the metronidazole because you are not sure about the diagnosis. But as far as the endemicity is concerned, actually many people are involved in the same area. It means that the disease is prevalent in that area. So you suspect the meningococcal disease and start treatment. Once in the hospital, in the tertiary care or the secondary care, the antibiotic of choice are usually intravenous broad spectrum third generation cephalosporins, for example, ceftriaxone, benzyl penicillin, chloramphenicol are also effective. Now this agent is very important, the chloramphenicol, chloromycetin. At one time we have used in 1975-76 because it will cause the pancytopenia. We are terrified from the effect of this disease on the bone marrow. Now this chloromycetin or chloramphenicol is not used usually nowadays. But it is a very important agent against the meningitis or meningitis. Remember, the combination will be given with amoxicillin, that is chloronic acid, augmentin with chloramphenicol. I will add also the metronidazole if I am not sure of it. It is very effective. You can give the carbapenems. You can give the other as well of the what is called as beta-lactam antibiotics are concerned. With a costly procedure, costly drugs. Supportive measures include the IV fluid, oxygen, and anotropic support. You know, the septicemia and the septic shock will be managed. And to reduce the intracranial pressure, you can use the dexamethasone along with the mannitol. Steroid therapy may help in some, but unlikely to affect the long term. Acute management is definitely important drug. As for chronic management, it should not be used. There is some debate on which antibiotic is the most effective, which a systematic review compared with the two antibiotics. There was one trial on open label, not blinded, non-inferiority trial of the 510 people comparing the two different types of antibiotics, ceftriaxone, in which there were 14 deaths out of 247. Relating now with the another one, chloramphenicol, 12 deaths out of 250. Why you are not combining this one with this? So the mortality rate will be much reduced if you use the ceftriaxone with chloramphenicol. There was no reported side effects. It will cause these the pancytopenia or bone marrow suppression. Only 1% cases are reported in the world with the chloramphenicol. Because it is used for the 7 days, 10 days, it will not cause problems. Over-the-counter drug, it will cause the problem because the people are taking the chloromycetin using in the salmonellosis at one time, and they have seen the cases that they developed the pancytopenia with the chloramphenicol. Even they have not come back afterwards. So the they need bone marrow transplantation at one time because total bone marrow failure occurs. Both antibiotics were considered equally effective. Its combination is very effective. It depends upon the culture and sensitivity. If you have done the blood culture and it is positive, then do for the culture and sensitivity and choose the antibiotic and use it. And that is the correct method. So treatment one is general treatment, isolation, hospitalization, because this is infective disease, care for monitor, nursing, prevent complication, maintain the fluid and the electrolyte balances, electrolyte treatment, and etiological treatment, antibacterial activity, concentration in CSF, resistance to the drugs, penicillin G, those should be properly given 200 to 400 international units per kilogram per day, chloromycetin, cephalosporins, and other than that, other antibiotics as well, carbapenems, monobactams. Other treatment, high fever, you give antipyretic and other drugs like anti-inflammatory. Increase intracranial pressure, you give the dexamethasone along with the 20% mannitol, 0.5 gram per kilogram body weight. It should be given straightforward and leading to 2 gram per kilogram body weight in divided doses afterwards. Prevention is better than cure, of course. In meningitis A, C, and B, and W, 135 vaccines recommended as a primary immunization. In the college students where the disease is endemic, and routine primary immunization, again the meningococcal disease is recommended for the most adults living in the areas where the meningococcal disease is endemic, or who are planning to travel to such areas, should be given. So in going for the Hajj, this vaccination should be given. We don't know from where the people are coming. Against the meningitis, you have to give vaccine. All the conjugate vaccines are the preferred meningococcal vaccine in adult conjugate. For younger, polysaccharide vaccines are an acceptable alternative for adults in this group if conjugate vaccine is unavailable. Since the safety and efficacy of the conjugate vaccines in adults older than 55 years of age have not been established to date, polysaccharide vaccine should be used as the primary immunization in this group. I'll say the polysaccharide vaccines are available. The government should provide, the WHO has always provided as a part of their program, the people who are going to the Hajj or to the Umrah or other gatherings, big gatherings, they should be vaccinated against this meningitis, against the Haemophilus influenza, against the pneumococci. So triple vaccination should be given, and that is a very good way to do it. Triple vaccination, that is called triple vaccination. So this is a brief discussion I have done as far as the Neisseria meningitis is concerned. Anything asked about it in the examination, where the patient has the clinical feature of meningitis, this Neisseria meningitis should be asked by the second examiner in the long case by A to Z. Remember it. He will not forgive. Please try to understand what I am saying. You think it is not important, isko padhne ki zarurat nahi. No. If it come, and you will be definitely afterwards, you will be sad afterwards. You will definitely have the consequences after this examination in the form of the depression. If the patient, second examiner will totally knock out you very easily by asking which type of organism, what is the root, what is the portal elementary, what is the pathogenesis, what is the pathophysiology, what are the target organs, etc., what are the recent advances, how will you prevent it, etc. So, my dear fellows and students, please try to remember which I have said in this tutorial. Try to to open this video and try to follow it. وما علينا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.